Hello, my name is Jonathan Fritz. I'm the Chief Innovation Officer for Chime. It's my pleasure to welcome everyone to today's Chime Innovation Beyond the Edge. This series is designed to share creative problem solving in response to COVID-19 and highlight innovations implemented by your peers. I'm really excited for today. Our session is COVID-19, a digital accelerant, and we've got Keith Perry from St. Jude's as our great Chime member doing the presentation today. A special thank you to Workday, our supporter for today's session. We know that you're very busy at this time and we really appreciate you joining us. Just wanted to take a minute to talk a little bit about why Chime is doing this. We've recognized that there are many challenges and problems that our members and many folks are facing. And this also presents opportunity for creatively solving problems. And that really is the core of innovation. And we want to celebrate the value and good that comes from that. Chime members really are facing significant challenges, have faced significant challenges, sudden remote workforce, spinning up and training clinicians on telehealth, infrastructure, resource constraints, starting up elective clinical procedures again, figuring out what a new normal looks like, trying to figure out how to move operations forward, working through challenges, having the gross majority of their team members be remote. From what I've seen, our members really are some of the most creative problem solvers. They're truly leading innovators. And when it comes to innovation, it's not all about the bright, shiny objects. Innovation during this time that is truly advancing health and care, impacting and saving lives, is really the most impactful and the most valuable innovations, period. So before we get started, I'd like to cover a few details. Our session will have three main parts. One, presentation from our speaker. Two, virtual roundtable sessions of 4 to 6 people, so everyone can have a candid discussion on the topic. And three, Q&A with our speaker. First, we're going to hear a presentation by Keith Perry, the Senior Vice President and CIO at St. Jude's Children's Research Hospital. At the end of the virtual roundtable discussions, we'll bring everyone back together for a Q&A with Keith. If you're unfamiliar with the breakout rooms, that's okay. I'll provide brief instructions prior to splitting participants into the breakout rooms. We'll have everyone muted during the session. If you'd like to ask a question, please use the chat function to alert the team. The chat window will appear on your right side panel. To ask a question, type your message inside the panel and press the send key. Questions for Keith can be posed in the chat function during this presentation or after we come back from the breakout rooms. I will be asking the questions in the order that they were received. We'll try and answer as many questions as possible at the end of the presentation. However, there's a chance we won't get to everyone. If that happens, we'll collect all unanswered questions and send responses via email to the attendee list. Also, we are recording this presentation. This will be saved and stored on the Chime site, so you can go back and review any details once we finish. Discussions within the breakout rooms will not be recorded. If you have difficulty listening to the live audio stream through your computer speakers, keep in mind that you can connect to audio via phone. If you need help with that or any technical detail, please use the chat window to send your questions. For those connecting via phone and your computer, please message the host with your name and phone number. Our host will then merge your phone and computer connections. Lastly, by attending today's full session, the presentation and virtual roundtable discussions, you will earn 1 continuing education unit for CHCIO, CFCHE, and CHISL certifications. We will review the attendee list following the session and distribute CEUs accordingly. With that said, I'm going to hand it over to Ryan Campbell, Healthcare Enterprise Account Executive at Workday, to introduce our speaker for today. Workday has been a significant partner with Chime, and we really appreciate them and specifically their support of Innovation Beyond the Edge for today. Ryan?
Thank you, Jonathan. It's a pleasure to be here with you and the rest of the group listening in today. I am Ryan Campbell. I'm an account executive at Workday, and I'm responsible for our healthcare business in St. Jude Children's home state of Tennessee. At Workday, we partner with healthcare providers across the country, delivering a single cloud-based finance, HR, and supply chain system to help increase agility and insight in their operations. It's my privilege today to introduce today's speaker, Keith Perry, Senior Vice President and CIO at St. Jude Children's Research Hospital. Keith is a longtime Chime member and friend with over 20 years in healthcare IT, spending the majority of his tenure in organizations specializing in oncology and cancer care. In his nearly 5 years at St. Jude, he's maintained a focus on interoperability and information security while spearheading technical solutions and innovations that help care for our country's tiniest patients. Notably, that includes mobile apps to support St. Jude employees and patients, the latter of which was recently nominated for a Webby Award, as well as St. Jude Cloud, which provides researchers across the globe access to pediatric cancer genomics data and interactive visualization tools. I'm looking forward to what he has in store for our discussion today, and I'm sure you all are too. With that, Keith, I'll hand it over to you.
Thanks, Ryan. I appreciate it. And thanks Chime for the opportunity to get to pull us together and have a conversation. This is somewhat therapeutic because of the last, 3 months that we've kind of lived in. What I'm going to talk about is my journey. But what I also recognize is that everybody on this call today has a very similar journey and a similar conversation to have. And so I'm more looking forward to the questions at the very end. But as I think about COVID, and while terrible, it has actually been an accelerant for many of us to kind of push a digital transformation. A lot of that was thrown upon us. And so what I wanted to do is kind of talk through our journey. But before I get in, let me talk about about St. Jude Children's Research Hospital. And it starts with a premise from Danny Thomas well over 60 years ago, that really no child should die in the dawn of life. And so our mission at the hospital is to advance cures by means of prevention for pediatric catastrophic disease, both focused on research and treatment. And so by doing that, we've led the way in how the world understands and treats and addresses childhood cancer and other life-threatening diseases. And our unique model, so we've got a different model than than other healthcare entities across the country, and that the majority of our funding comes from generous support from our donors. And by doing that, we are our model is that no family should have to worry about the financial stress of the burden of paying for their care while they are at St. Jude, and instead they should be focused on the care of their child and providing comfort to that child throughout that journey. So let me tell you a little bit about what St. Jude campus looks like today. And I'm going to get into some timelines. I'm going to get into some of the transition and transformation. And so right now we are sitting at really essential function only, which is about 1,000 people that come to campus on a routine basis. And we're in that level of phase right now. We're entering into kind of a return to work plan, and primarily that's around bringing our research labs and entities back online. And so for the vast majority of our workforce, they've been working remotely. And basically we've pushed them off campus and said, be as productive as possible, as productive as you were on campus, sitting at your house. I'm going to talk through some of the reasons that we've done that and how we've been able to do that. And during that time, we have not only set up COVID screening, where we're asking the same questions that every one of us are asking when we're inviting people on campus, but we've set up testing for employees and nasal testing. So we've had to break our badging into clinical, non-clinical to kind of segment the campus, and that we're also all wearing our mask, as I'm sure everybody on this call has their mask sitting right next to them. So let me tell you a little bit about our IS COVID response timeline. And I made the comment to somebody that we've introduced more change in the last 2 months than we did all of last year combined. And it really starts back to early February when we stood up the Incident Command Center. Before that, we were tracking this disease and growing concerned on what the impact was, probably late January. But really with the incident command, that kind of launched into a series of things where we started pushing people off campus. And I'm going to walk through each one of these points on this slide, including what we are launching actually today. But one of the first things that we had to do is, and this is conversations with senior IT leadership, is, okay, if we're pushing people off campus, how are we going to be monitoring what's happening? And so we had to build a dashboard to kind of manage whether that be VPN sessions or internet circuits, but also phone calls to the incident command, phone calls from our patients. And so we set up a dashboard for not only technical teams to use, but also for executive leadership to use to kind of manage the health of what's happening just from a pure technology perspective. And then the other thing that we really had to do is looking at this, again, as many of you were probably struggling with this, our VPN capacity was probably in the 500 range when we started this process. And that had been successful for us. But when we looked at, okay, if I'm pushing 4,000 people off campus, how do I make sure that that is sustainable? And so we went down the journey of not only increasing VPN capacity, but we went down the pathway of really pushing the you don't need to use the VPN to access campus related work. And so we started with this My Apps portal, which we had in place, and there was probably 5 apps. All of them were Microsoft Office 365 related. And so over the period of about 2 weeks, we ported 110 web apps into the My Apps portal and really used this as the launching pad for people to get their work done without using the VPN. And so we've done that. We've got about 200 to 400 users that are using this per hour. Now, primarily, a lot of them use that for timekeeping purposes, especially on Monday. The other thing that we realized is that we weren't doing a good enough job with kind of consolidating our remote access communication. And so we created a consistent message for staff and employees and a landing spot that if you need access to use remote, to be remote, go here, and it provides links to all the applications, provides mobile applications for downloading. We had video tutorials that we were bringing online. It was really just a concerted effort on our part to do a better job of communicating with the institution on how they should be using remote tools to gain access to campus-related applications. And again, kind of taking breaking the VPN habit one step further, we had a lot of researchers that didn't just need access to applications here. They also needed connectivity here. And so when you think of the research community, it wasn't good enough for them to just take their workstation home. When you're talking about genomic data and large data sets, we needed the ability for them to gain access to compute resources here. And so at the same time that we were doing all of this, we were building a digital workspace for our community and our users as well. And so we launched that over a period of 2 weeks. And then that brought, Windows 10 desktops. We ported software applications and St. Jude configured browser. And now we're really, again, taking that one step further, breaking the VPN habit, but also allowing our research community to continue their work with high performance compute resources without having be right next to the data and to be remote as well. And that also extended to bring your own device. So that was not we allow that securely without having to force the community to have a St. Jude owned device. And like many of you, telehealth has really taken off here. Now, the numbers that I'm going to show pale in comparison to some of my colleagues on the phone. And so we were kind of dabbling in how does telehealth really impact somebody with a catastrophic pediatric disease, where our primary motive is to bring them on campus, to put them up in our housing. And what that's done over the last 2 months has really exploded. So our first case was seen March 20th with psychology. And then just over that first 22 days, we saw 97 patients. Again, this pales in comparison to some of the numbers I'm hearing. And then we've also, since we had our own school program, we've also extended that to school programs as well. We started with 13 use cases. We've trained 150 providers on how to use it. We've integrated that within our Cerner EHR. We send patient kits out to our families. And it's really been a positive impact. Now, again, our families, some of them are across the United States. Some of them are actually here in our housing units. And so we have extended telehealth to our housing units, because the thought is that why should you have to walk across campus when we can see you sitting in your room at one of our housing units? So that has been extremely helpful, and one of the things that we see kind of continuing and expanding post-COVID. So I talked earlier about this push of 4,000 people off campus. And so our culture, like many of you, is really, really strong, and people like to be able to be part of the culture here. We do things for our employees all the time. We're a locked campus, so you're not getting on campus unless you're here to do the work of St. Jude. And what we were trying to do is think through ways of how do you extend that community feel to employees and staff that are working remotely. And so we started with, hey, let's build some puzzles, some St. Jude puzzles. So we did that. We've extended that to yard signs. Now we're extending that to t-shirts. But what we needed was an internal storefront for people to sign up, for us to capture their information on where that should be shipped. And so that has been something that an idea came up on a Thursday, and I think by the following week we had something up and operational. And so that was really exciting, and kind of continues the connective tissue of the culture to people working remotely. And not 2 days into this, we were standing around, and the question came up is, okay, how do we sign contracts? Because typically we had routed contracts for wet signature and hadn't been really interested in digital signatures. And so the COVID kind of accelerant said, okay, this is not sustainable. We can't drag administrative personnel into the office just to print contracts and to follow them around to get ink on a piece of paper. And so commissioned about 3 people to kind of go off and build a St. Jude branded process. And that resulted in kind of using DocuSign, again, St. Jude branded. So we have some trust in the process that it's coming from St. Jude. And that would allow us to sign contracts without dragging people onto campus, and to continue to move those contracts and other agreements forward. And then at the same time, you know, the need to be connected to our employees. Our president was really interested in virtual town halls, and so we've had several of these. We're planning even more, and that will just continue. But that kind of posed a problem for our AV teams, and how do you have, you know, 4,000 people dialing into a WebEx when you know, they don't necessarily all know how to mute their phone, and so how do you do that? So we've had to learn through that that experience, which has been sometimes a challenge in getting people to know how to behave when they're on a video call. All kinds of stories that we can talk about that. And then one afternoon, our global leader came to our executive leadership group that was meeting and said, hey, we have this idea on, we want to be the leader in not only how the world thinks about childhood cancer, but how is the world dealing with COVID as it relates to childhood cancer. And so over the span of a week, we stood up a global registry, a global website that included breakout rooms that has just been very well received across the globe on helping those across the globe deal with and share stories and best practices on how others are dealing with children that are impacted by this disease. So that has been a huge success. Again, stood up in a week's time. This would have taken probably at least 4 months pre-COVID. And then one of the things that we're working on right now is I talked earlier about, look, we're requiring symptom screening. So we're asking 2 questions. It's a very manual process today. And we're identifying people that need to get tested. And it's typically on a routine base, on a weekly basis, but it's really dependent upon whether or not you have direct patient care or indirect patient care or no patient care responsibilities. And we've locked campus down to a few access points. And that works when I have 1,000 people coming to campus. It starts to break down as I have a phased return to work where I'm bringing more and more people back to campus, and will become an issue. So we had this idea of, well, can we put that ability to ask those 2 questions, and in that logic determine whether or not they need to be tested. And then it becomes a flow issue. And so we built this mobile app. We call it St. Jude Paths. It asks the 2 questions. It's querying a back-end system and determining whether or not they need to be tested that day. And then once they're tested, so if they answer no to the 2 questions and they don't need to be tested, it's going to give them a green badge that they would use for security access. If they need to be tested, it'll throw up a yellow badge that they would use to go to the testing location. And then if they are placed in a quarantine status or occupational health has determined they are COVID positive, or they answer any of those questions yes, it's going to throw up a red badge and then direct them to call occupational health. And so this is kind of a campus control tool for us, and we see this kind of expanding to our patients at some point. And then when we start to let more and more visitors on campus, we see this same thing being extended to them. But we're starting with our employee population. And then other things that we've done over the last 2 months is we saw this early on. A lot of the people that we pushed off campus had desktops, and so what we didn't want is loading up their car with a big monitor and a desktop. And so we started a laptop loaner process. Luckily, we we placed orders in early February for additional laptops before that supply line kind of dried up or became harder to get. We've extended that to loaner desktops, small form factor desktops that people need. We've launched Yammer on campus. And again, that's just part of the how do we remain connected to our employee population. And that has been a huge success for us. And then we're looking at other innovation in terms of wearables with RFID, because what we're, when we're talking about staying 6 feet from somebody, we're talking about wearing masks. How do we make sure that we're compliant with those safety precautions? And so we're looking at some type of technology to help with that as well. And so I have one slide before I throw up the questions is, as I was thinking through this, there's some common themes that really kind of span across all of these. Is one, time was not on our side. It was a constant constraint. It put a lot of pressure on people to perform. And what we had to do because of that is, make a determination of, look, we can always improve this. Don't let perfect get in the way of getting something out there. So we've come behind with process improvement and releasing updates to not only the technical things that we've updated, but also the kind of the workflow changes and for campus access. There's been a really strong alignment across all institutional leadership. So we meet daily as a leadership group. The Instant Command meets twice. We're giving updates on what we're doing. And there's just constant discussion and alignment across that, the entire leadership team, and a focus on what needs to be done. The other thing that I noticed is that it's, innovation is, we're inserting it, the right type of innovation at the right time. So it wasn't like we said, hey, we're going to wait and come out with a mobile app. We said, no, we're going to come out with a manual process because we don't have time to wait for the development. And so it was this really an iterative process on evaluating where's innovation make sense, and let's focus on the need, the immediate need, while we focus on building the innovation that would come at some point in time. And now we're in the process of how do you make this sustainable and scalable? We don't see this stopping anytime soon. And so we're taking steps to make this sustainable and scalable over long term, which is why we're putting in place a mobile app, which is why we're trying to track compliance technically. And so we're having those discussions right now. But kind of the sum of that is the themes that we, as I step back and think, that was kind of guiding us throughout this whole process. And so with that, okay. So the discussion questions that I want answers to, because these are something that I'm struggling with, is how do you sustain this momentum of innovation with leadership? So, we sit in a room, we make a decision, and then we're allowed the freedom to get something done. Pre-COVID, we'd have a lot of discussion before something would spit out, and it would just seem to take more time. Time was not a constraint. The second question is, what innovation really is that we're doing right now that really will be sustained once this COVID-19 accelerant is reduced? And then how do you build this or grow this or continue this culture of constant change within our departments? And so so those are the three questions as I kind of step back from a innovation perspective that I'm struggling with. And so I thought it'd be great to kind of throw them out there and see what other thoughts are. So with that.
Welcome back, everyone. Hopefully you had a lively discussion with Keith. If you've got any remaining questions for Keith, please put them into the chat function at the bottom of your screen. So I'm going to ask a couple of questions for you, Keith. One of the things that's kind of interesting to hear during your presentation is that St. Jude still had a process of distributing contracts for wet signatures. Being a recovering lawyer myself, it's something I'm maybe particularly interested in, but I'm kind of curious to hear, are there other processes that have changed or ones that you're looking at changing that would be through really the adoption of existing technologies? And maybe it's, changing, processes that have been long-standing at your organization, but perhaps COVID is something that is further, accelerating that. Keith, I think you're muted.
Okay. Man, that was a great answer. I hope you heard it. Yeah. So one of the things that we're just now starting to really jump into is what's the long-term impact, and not only DocuSign, but what processes are we doing today that can be really more efficient in the future, knowing that this is going to be with us for a while, and two, we don't know what the financial long-term impact is going to be. We're just modeling that, and so we're taking a process, whether it be I need to purchase something, and we're trying to we're breaking that down right now to figure out where we can drive efficiencies. And then two, just a shout out to Ryan is, prior to this, we had made the decision to move forward with Workday implementation. And so we see that as a long-term fix to a lot of our inefficient processes that we have in place today. So both a short-term and a long-term answer there.
Excellent, thank you.
And a shout out to the sponsor. So
perfect. I think it was probably a 10 out of 10 answer. Thanks. You also mentioned about the ability to continue innovating as the pandemic it continues and then eventually hopefully subsides. Are you seeing any internal partners or allies that can help carry that message with you or support that message?
Yeah, so what you find in these type of situations, you find out who steps up and who either stays where they are or even takes a step back. And so I found new partners, just working in a command center with somebody day in and day out, you find out who's going to help champion and carry that message. Like our head of communications has really stepped up. She's the one that came forward and said, hey, wouldn't it be a great idea to puzzles? Because if you remember, now this is so February, as you couldn't find a puzzle on the shelf. And so she had this idea of, hey, let's make our own puzzles and let's get them out to staff. And then, having that conversation in a group, we're like, well, okay, we need a storefront and this is what needs to happen. And so you find all kinds of opportunities to partner with people when you're thrown into an arena with a common goal.
Excellent. How about any other friction points that have come up, maybe internal, with your team interacting with each other, or it could be clinical, it could be, IT systems, any friction points that came about as a result of COVID that you were able to get beyond, or that you're still working through, that you think our other members would be interested to hear about?
It's just the friction point of time. And so while some technology is fairly easy to stand up, given if you reduce people's priorities down to that and reduce the burden of their support, they can focus. There's some that just take more time because they're a lot more complex, especially when you're talking about integration. And it's not, so just take the mobile app that I talked about. integrating that was not easy. And they wanted that up and running in a matter of a week. I was like, yeah, it's not going to take a week to do this. This is going to take a lot longer to do. And so just the friction point of time has been both a motivator, but also an enemy in terms of the stress and the pressure.
Excellent. And as far as moving forward with what many folks refer to as the new normal, what are you seeing as far as timeline for bringing back, say, even 30-40% of your team, and folks coming back, working into the office, and any other aspects of that new normal, what that looks like, and potentially even timeline?
As I was telling another group, I don't see that. So right now, 90% of IT is working remotely on 5 days a week, and there's people that come in and support what we're doing. I don't see that changing. I don't see 60% of our workforce ever coming back to campus 5 days a week. They may come in twice a month for cultural connectivity things, but the vast majority of the feedback I've received is, I like working remotely. I like the freedom. I like the fact that I don't have to put on shoes and for my commute. But I don't want to be told I can't come to campus because of the connective tissue that is there. So I don't see that changing for us. And the other reason is, until we have a vaccine, there's a lot of our population that's very nervous about coming and sitting in a cubicle that they did in January. They just are uncomfortable, even if we tell them we're deep cleaning it every night and we're testing everybody that's coming onto campus. There's still just this hint of uncertainty that's out there that's going to drive people to continue to work remote.
Hey, Keith, this is, one thing that we didn't talk about, and I'm wondering, with so many more people working remotely, how is that going to change our hiring and recruiting practices in the long run? I at another organization, actually in Memphis, I had one of the first teams that was actually 100% remote. Sorry, I got kids in the background being crazy. And, it actually worked out really well. It went from a team that I would have, the original team I ranked as probably a D, and they came back and they were an A team. So I wonder, just nationally, how this is going to, shift the workforce.
So, I mean, if you want my thoughts, I think it will radically change how we approach talent. So when I first came to St. Jude, we had already we started to institute hiring remotely for those hard to find positions, primarily in clinical research. We've extended that to other clinical positions, but I see that changing even further now, and because it doesn't matter where you are. No offense to the people in California, our HR people have said, look, you can go anywhere, just don't go to California because of some of the employment laws. So I look at that as an opportunity, as I can recruit you to the St. Jude mission. The challenge that I have is recruiting you to Memphis. So if that should not be a barrier to finding the best talent for our mission, regardless of where you sit. I see that as it'll revolutionize how we go after talent.
Thanks for the question, Donald. Appreciate it.